Hey everybody, give everyone just a few more seconds to pile in here and we will begin shortly. All right. All right, everybody. Well, welcome to your Global Medevac digital presentation. Very excited to be here and tell you what it is that we do and how it is that we can help you out. So here at Global Medevac, we've got quite a few different options to protect your family and to protect your finances, and we're going to talk a little bit about all of that here today. So very excited to be the one to do that with you. So right off the bat, my name is Justin Elder, and I'm the Senior Regional Sales Manager here at Global Medevac for the Arizona region. And what I do is I coach and help develop a team of representatives to go out there and talk to you folks. So I've got quite a few in Arizona, spread out all the way through the Midwest, even one in Colorado as well. So if you have any questions, reach out to me. I'll get you in touch with one of my team, and we'll make sure that your questions are answered. If you type in a question below, make sure that you bring your questions to us today. If you do type in a question, I do not get to it today, I will return it via email. So excited that you're with us. So let's go ahead and get going. So in today's webinar, I do have a little bit of an agenda. What it is that we do here at Global Medevac, which I will expand on obviously as we go through today's webinar, is we take care of matters of a more serious nature, things that we're all going to have to deal with at least once in our lives, and we take care of those things without hesitation here at Global Medevac. So ambulance care is not covered the way that it used to be, and we're going to talk about the why of that and what it is that we can do to protect you, as well as all of our benefits here at Global Medevac, which are extensive and very comprehensive. So let's go ahead and jump right into that. So we're going to cover these topics, like I was mentioning, about the ambulance coverage in 2021, how it regards past COVID. The Affordable Care Act that took place in 2015 really changed the whole dynamic of what it is that we do. So we are pretty much in that game to cover you from those events. There's been a lot of changes, and we want to make sure that those changes are completely in our wheelhouse, and for our members, we're completely covering those topics today to make sure that you're fully aware of what it is that we do. So once the ACA took effect, it really changed everything, because the ambulance coverage was the first to leave, and it really created a situation where folks don't know what they're paying for ambulance coverage anymore. Insurance and Medicare are not covering those costs anymore, and surprise billing is a sobering reality. And I'm going to show you a few of those bills that we've covered just to give you an idea of the necessity for a program like what it is that we have. I'm going to show you why Medicare and insurance are no longer paying for those invoices. And then I'm also going to talk about what it is that our coverage entails for our members that really does go above and beyond what you can find out there. So we are a members to members coverage. We are not insurance. I would want to say more along the lines of supplemental coverage, but we are here to negotiate those costs for you, those ambulatory costs, any kind of medical transportation, and we are here to pay those out-of-pocket costs for our members as well. So we'll go ahead and talk about all of that at the end. So right off the bat, why? Why Global Medevac? Why is this needed? So I could talk about this really extensively, but I think the best course of action really should be independent research. If you know somebody, or you yourself has been in an ambulance ride within the last 4 or 5 years, you know that these costs are no longer taken care of. So I'll go ahead and leave it to ABC Good Morning America for a quick little video, and let it play here, show you the dangers of what it is that we're dealing with and why it is that this is a necessity.
Insured consumers got a surprise bill just in the last year, and now Congress is working to curb these unexpected charges. Kara Phillips here with the story. Hey, Kara.
Good morning. You know, this really hits home for me, George, because my son had a freak accident. He almost lost his hand, and I rushed him to the hospital. And when we got to the emergency room, he saw 3 doctors, and it never entered my mind to even ask if they were in network. So we are talking about unexpected charges that most of us assume, if we have health insurance, would be covered. Not always the case, so we spoke with the experts to find out what you can do about surprise medical bills.
$17,000 for a lab test, $50,000 for a stay in the NICU, $70,000 for surgery for a broken hip. Just a small sample of surprise medical bills patients say they never saw coming.
It's causing incredible distress and financial harm to hundreds of thousands of Americans.
Tom Saputo, once an active snowboarder, says his family was devastated when he was diagnosed with pulmonary fibrosis. He needed a double lung transplant to survive.
It's like drowning. You can't breathe.
Throughout Tom's care, the Saputos say they made sure that everything was in network.
Yeah, there was always a double check before we had a procedure done.
But while bedridden at a local hospital in California, Tom needed an air ambulance to a medical facility where he could receive the transplant. The Saputos did it, no questions asked.
How could you even have the
Wherewithal.
to concentrate on something like that when your husband's dying?
Tom received that transplant, but then came the bill that blindsided them. The transplant, $36,000, was fully covered by their insurance, but the air ambulance that cost $51,000 was not.
And so we were shocked.
GMA became aware of the Saputo's case through Kaiser Health News and NPR's series, which investigates medical bills.
Air ambulances are the single most common complaint in our database.
The Saputo's insurance covered most of the air ambulance bill, even though it was out of network. But they say they were told they still owed $11,000.
How are we going to pay this bill?
The Saputo's insurer, Anthem, told GMA the costs for his transport were paid in accordance with his benefits plan. After GMA Investigates contacted the air ambulance company,
your account is actually at a 0 balance now.
the Saputo's debt now erased. Air Methods telling GMA after that call, we engaged in the appeals process to receive the full payment. Because Mr. Saputo was extremely cooperative, we were able to provide him a 0 balance. Nearly 80% of Americans want legislation to protect patients from surprise medical bills. The president also calling for regulation.
They should be given a clear and honest bill up front.
Representatives Frank Pallone Jr. and Greg Walden are co-sponsors of one of the bipartisan bills before Congress that would regulate the practice.
Why hasn't a bill been passed?
Well, we are moving. The process takes a while.
Ads criticizing some of the legislation began running over the summer.
They're not influencing you.
We're going full force ahead.
More than half of all air ambulance rides are out of network. So we asked specifically about the Saputo's case.
Why doesn't your legislation cover this?
When you deal with ambulance, it involves so many different factors. The ambulance might be private, it might be the local government. So it's very difficult.
But clearly it's not working.
That's true, but it is a different animal. So we're taking on what we can here.
All right, so as you can see with the Saputos, it's not necessarily a thing with insurance. They thought that they were fully protected. They thought that they were in coverage, and it turns out that when they used that coverage, it wasn't available for them. And that is very common and not at all what we do. So we're going to talk about why global Medevac and our necessity for that. So the same processes that brought us cheap and competitive airline flights is the exact same process allowing for these absurd for-profit ambulance providers and what they can charge. It's a life-saving endeavor of what they do. It is absolutely vital in these communities, especially in the rural communities, to have this service available. If you're up in the the islands of Washington State, you're going to need service to get to the mainland. If you're in the rural areas of Arizona, out in the desert, you're going to need this service to get to the larger towns. Ambulance rides are just not effective. They're not available and they're not feasible. They're expensive. They're long journeys, and we're going to get into that. So, have you ever taken a sightseeing helicopter flight? A few $100s for a guided tour. Any idea how much for a medical flight that saves your life? Well, stay tuned because I'm going to show you some bills here in just a few minutes. But precisely put, Global Medevac is here to protect families just like yours from the enormous cost similar to what you just witnessed in that video with the Saputos. Plus, we do so much more. Global Medevac is here to cover all Americans. We are here to cover just about everybody. We're here to cover folks just like you. We cover the individual. We cover the families of any size. We cover the retirees. We cover all folks in their age groups. Who does Global Medevac cover? We cover folks just like you. Whether you are out doing adventure activities, rock climbing, mountain biking, we have you covered. Whether you like to go RVing and camping, we have you covered. How about if you have a kid in college? We have them covered as well. Even if you like outdoor activities, ranging all the way from fishing, all the way to motorcycles, it doesn't matter. No matter what it is that you're into, we have you covered. How about if you're a business owner or in charge of large groups and the benefits for those groups? Global Medevac has you covered for them as well. Who does Global Medevac cover? All United States residents. Simple as that. So, what is Global Medevac? Well, simply put, Global Medevac is a members-to-members coverage that, not unlike Costco or AARP, provides extreme benefits for the membership. Our benefits are absolutely fantastic, and they cover all of the costs, all of the out-of-pocket costs in regards to a multitude of medical transportation needs. So we service both the emergent and non-emergent ambulatory calls. Global Medevac provides 19 members-only benefits and services. This is the most unique and comprehensive protection available. There is not a coverage available comparable to what it is that you're about to hear. Global Medevac is the solution. We are the peace of mind that you and your family deserve. Every one of us are exposed in regards to the ambulatory costs, and here's why. So we're going to talk a little bit about this Obamacare kerfluffle. So the Affordable Care Act and the pitfalls that came from this really did do a number on our Medicare system. So as you can see right off the bat, $260 million were cut from the hospital services from the total of $716 billion. Well, of that $260 billion was the ambulance care. The ambulance care is now almost all of it is privatized. So with that being said, there are a little over 2,400 private air, ground, and fixed wing ambulatory services. Almost every single one of them has their own membership. With that, Medicare and insurance are not wanting to pay up like they were prior to this plan being enacted. $716 billion were cut from the Affordable Care Act. $156 billion from the Medicare and denial of payment services. That's crazy, and we all know that if Medicare is denied, then the insurance and the Medicare supplement coverage are also going to be denied as well. So, if there are lower Medicaid and Medicare payments and lower health insurer payouts, plus non-payment by private pay patients, it creates a perfect storm, and we're seeing it all over the place, specifically in the rural areas, is hospitals are closing left and right. That is very dangerous for us. So as the lower trauma areas are not serviced, it really puts a crimp on the ambulatory services to get these folks in their emergency time of need, in their golden hour, the 60-minute window that we need to save a life. It cuts that window down extremely when we have to incorporate long distances. So according to a study from Navigant, up to 21% of rural hospitals were going to close due to financial strain. And that was before COVID. 21% is 430 locations across the country were going to close this year because of financial strain. Well, COVID did an even a bigger number on that. And so why is this important? Well, it's all about the level of care available. Like I said, if those hospitals are closing, and they need to transport these folks to a higher level of care for emergency services and no one's available, it becomes very expensive. So what is a level 1 trauma center and why is that important? A level 1 trauma center provides the highest level of care with specialized medicine, and it's staffed 24/7. Transports are often of great distances. They're often of great distances for the rural residents, and the cost of ambulance services frequently exceed the cost of the hospitalization itself. Most states only have a handful of hospitals equipped for all emergencies. Vital, life-saving emergency service. I know what you're probably saying to yourself right now. I get it all the time. My insurance covers ambulance care. I don't need any supplemental coverages. Well, I'm about to show you exactly why that's not true, because you do absolutely need coverage like this. This membership covers all out-of-pocket expenses that Medicare and your insurance will not. We also include on that coverage, including copays and deductibles. Had these patients in the next few slides had a Global Medevac membership, just like if the Saputos from the video had our membership, they would have paid nothing. They would have been completely covered with their out-of-pocket costs, instead of facing bills like these while still having insurance and Medicare coverage. All right, let's take a look at this one, this ground bill ambulance. So on this particular journey, they were transported 9 miles. How many of us are 9 miles away from a hospital? Especially in the rural areas, very few of us. So that's going to be quite a bit of a range from there as well. So right off the bat, this patient was charged that $1,361 just for the ambulance ride, and then the mileage on top of that was an extra $123. So the total charges for this bill before insurance was $1,484.21. The balance after insurance was paid, $1,019.70. Let's take a peek at the next one. This one went 20 miles. Very similar instances as far as the ambulance here and the rural ambulance mile charge of $420. So before insurance picked up $374 of it, the total charges were just north of $1,700, leaving the balance bill for this patient $1,343.60, which isn't too bad, right? I mean, most of us can understand a bill, especially if it's not something that we're using all the time. It's an emergency. $1,000, even $1,500, that's pretty understandable. Just to start the vehicles these days, just to start most ambulances, it's about $2,000. So whether or not insurance picks it up or not, those are those balance bills. So let's take a look at this one. The air ambulance bills are obviously the most expensive one. This one was one of the better ones I could find of most recent that we've carried. So the payer on this one was Blue Cross Blue Shield of California, and they picked up a great chunk of this. Before they jumped in, the total cost was almost $42,000. This flight only went 25 miles. That's it. They picked up $33,000 of the little over $33,000 of the bill, which left a balance bill for this patient of $8,309. $8,310. That is amazing. That's amazing just for that. So that balance bill in and of itself is quite a bit. So the next one's a scary one, because Medicare and insurance these days, if they are not deeming that the ambulance ride was a necessity due to a life-saving journey, a life-saving flight, a life-saving ambulance ride, they are passing most of those fees on to the patient. So let's take a look at one that insurance did not pick up. So here, very similar ride. They went 26 miles, not a life-saving flight. $33,464.90 was passed to the patient. Insurance was denied. The claim was denied on this one. So that's what we're dealing with, and that's the scary stuff. It's the Affordable Care Act pitfall that we were talking about before. So if insurance is not working with these private companies to take care of these costs, somebody needs to, and that's where we step in. With the cost of air ambulance transports increasing at an alarming rate, payments by even the best insurance coverage leaves a substantial balance for the patient. Average claim in 2009 was $17,000, while insurance was picking up these claims. The average claim in 2019, $52,000. And that's because there is no regulation on this. So in 1972, the FAA deregulated the airline industry and allowed the for-profit helicopter companies to play in that game as well. And since it is a on necessity flight, it is the same thing. We're dealing with the same thing. So that's what I was saying before. So a helicopter ride through the Grand Canyon might cost a couple $100, but a helicopter ride from point A to point B as fast as possible in regards to medical care could range tens of thousands of dollars because of the care involved. I mean, let's not cut words on that. It is due to the care involved. I mean, these are specialized doctors, nurses with the very best of care. They have cut the golden window time limit or time frame down substantially by being able to bring the hospital to the patient in the time of need. So what they do is absolutely fantastic. It's vital. It's a vital necessity. But the danger is that for that life-saving service, Medicare and insurance just are not covering it like they used to. So the services have gotten more abundant. They're able to do more. Technology is greater. The cost for these services have just increased, and insurance and Medicare are not doing anything to do anything about it. And here's why. So Medicare is paying just about $6,500 on average for the helicopter ambulance transports, if they're paying at all. Most, if not all, of the providers in the state and throughout the country are out of network, like I was mentioning, with virtually all insurance carriers. So what most policies now only pay based off of what is called the usual and customary charges or maximum amount allowable. So how this works is, let's say you have a flight of $45,000. You take a flight, you get a bill, it comes in at $45,000. Well, you send it into Medicare, you send it into insurance, and they say, well, that's fantastic. The flight itself in that nature of let's say your neighbor took one, that's only $30,000. We paid $30,000 of that. So that's what we are going to deem as a usual and customary charge, of which we'll take care of the 80/20 on the back end of it, which is a $24,000 balance that we'll take care of. But that leaves you, Mr. and Mrs. Patient, with a balance of $21,000. So that's how they're able to do this, and they're not taking care of these charges like they used to. Medicare and health insurance carriers are restricting the transports that they deem to be medically necessary to reduce their payments for these bills, and this leaves the patient with large balance bills. This is the crazy thing because of these claim denials. They right now are reviewing every single emergency medical transportation claim to make sure that it was done in the most viable means necessary. They want to know, could you have taken an Uber? How about your neighbor or your spouse or your sibling? Could you have gone to the hospital by any other means necessary and been able to keep it safe? Often Medicare only covers ambulance expenses to the nearest facility that can provide care without regard of the level of care needed. So they'll pick you up from the 911 call, but if you only live near a level 4 trauma center, but you need a level 1 trauma center, they will cover the cost to get to the original facility. In most cases, that next facility transfer is out of pocket. You might have this concern because I hear it all the time. Medicare takes care of all of my medical expenses. Well, for 9 out of 10 of us, that is not the case. So if you are one of the lucky ones to be fortunate enough to be on a plan that is no longer provided through Medicare, that's fantastic. But for the majority of us, 9 out of 10 of us, there are going to be residual costs. And those costs come in multiple different ways. Copays, deductibles, invoices typically for the out-of-pocket expenses are very typical. And we also do have a limit for those that do not have Medicare and insurance. But other than that, if you're covered by Medicare and insurance, we cover all out-of-pocket costs. Global Medevac membership reimburses you for all out-of-pocket expenses due to that ambulance care. I get this one too. I'm covered through another transportation membership, which is absolutely fantastic because you understand the necessity for this. Here in Arizona, just alone in Arizona, there's 20 for-profit air ambulance companies. So if you are in one town, you're going to get a rotation of a certain number of companies for that. If you are traveling to the north part of the state, you're going to get a completely different branch. So those companies and their memberships do have limitations. That is not what we are here to do. You may be covered in those cases that your provider is the company dispatched by 911 at your time of need. There are currently over, like I mentioned, 2,400 air and ground ambulance providers in the continental United States. All of them have their own membership. So if your provider is not the company routed by 911, that membership is essentially useless. And we hear it all the time. Unless you are a member of Global Medevac. We take care of all of that, and we use all of the existing companies already doing their ambulance services, and we just pay the bills. That's what we're here to do with our members-to-members coverage. We are the premier worldwide protection utilized both at home and away from home. Because with this membership, you are essentially a member of every company. Global Medevac negotiates with your health provider, insurer, and the transportation service to get you the help that you need all while protecting your finances and your family. So my question to you is, are you prepared? Statistically, 1 in 10 Americans will need life-saving emergency services at least once in their life. Americans account for over 500,000 air ambulance transports annually. Last year was 553,000. The cost of ground and air ambulance services have tripled since 2015. Does your health insurance cover all the costs? I might argue that they won't. What if traveling international? Medicare and insurance are almost useless when trying to get home, especially if you don't have one of those fancy plans that they don't offer anymore. Well, we have your back here with Global Medevac because we've got worldwide coverage available for you. And here is the reality of the situation. The costs of these ambulance services are often devastating to these families. One can easily be risking their retirement and nest egg just to pay for one unexpected emergency transportation. Even with the assistance from Medicare, the average retired couple faces $275,000 in medical bills. A study done by the Kaiser Family Foundation found 26% of Americans file bankruptcy due to medical debt, ambulance costs being near the top of that list. In 2017, Debt.org published that folks aged 55 and older account for 20% of total bankruptcy filings. Don't let medical transportation be a concern for you and your loved ones anymore, because there is a solution. And here it is. We are the solution because Global Medevac is your peace of mind. Global Medevac protects you against financial difficulty due to emergency medical transportation. The founders of Global Medevac are the pioneers of the medevac industry with more than 100 years of combined experience protecting families just like yours. Let's go over our levels of membership and the benefits that entail, because I know that's why you're here. So let's go ahead and talk about the good stuff about what it is that Global Medevac can do. So we've got 4 levels of membership available. We do have a monthly plan, a monthly option for our yearly plan. Our yearly plan is absolutely the most popular option that we've got. We can shrink the bills down a little bit from our yearly option to a 5-year plan. And then we also have a lifetime plan for those over 55. So that's an absolute fantastic deal. It's kind of our ultimate senior discount, as it is a one-time fee sort of aspect, and then you are on your way, and you never have to worry about any kind of ambulance service again. Plus, you get the benefits of what it is that we're going to talk about here with our world-class benefits. So here is why I am here, and honestly, the best part of my job is I get to explain what it is that I do to protect folks. So right off the bat, you're covered from day one for everything for the emergency services. So that includes 24/7 ground, air, and helicopter transportation. So whether you are in need of a transport to a hospital or a flight to a different facility, a ambulance ride to a different facility, we have you covered on that. We also have you covered for the medical repatriation and return transportation as well, which is fantastic. We do provide those costs. We do provide those aspects, as it is the most expensive part of what it is that we do. So whether it is in between states, or just getting home from the hospital or from international travel, those repatriation aspects, we have you protected on that. We also take care of the paramedic and assisted commercial flights. That is also expensive if we have to bring on any kind of doctors or staff on board, and we've got the best life-saving emergency staff in our network that we take care of for you. We also take care of any return vehicle and pet transportation. We provide visitor and escort transportation as well. So if your vehicle and pets and family are left stranded because of a medical emergency, we will make sure that they get on a flight home, and we get everybody home safe and sound. That includes sending someone out to take care of your vehicle as well. So whether it's an RV or a towed vehicle, we will make sure that we send a licensed and bonded driver out to that location to bring home your belongings. So that's something that insurance and Medicare most certainly won't cover. And like I said too, we'll take care of the grandchildren, great-grandchildren return. We also provide with this service a concierge service. So that provides things like language service when you're international. We do have things like, if you lose your passport, you can give us a call and we can help you with that kind of stuff. So absolutely fantastic. I even tell folks that if you're in the need of a plumber, you might as well give us a call. We might have somebody on our list for you. We take care of any kind of mortal remains transport. So if a member should happen to pass away outside of their home area, we take care of the cost of getting them back home to their family, and that surviving spouse as well, if they happen to pass on outside of their home area. What is unique to Global Medevac, and you do have to be with us for at least 1 year, is we do take care of all of the costs with organ retrieval as well as an organ recipient and all of that transportation. So that is something that absolutely no other company will be able to touch, and we're very excited to be able to offer that. All right, and so all of those are available in every single one of our plans. We have a few benefits only available available for our lifetime membership, and that's what these include. That includes travel expenses for your visitors, so a daily stipend for anybody that has to come visit you. So if it looks like a serious issue or you're going to be in the hospital for an extended period of time, we want to make sure you're not alone. So we're going to take care of getting somebody to you. We're going to take care of any transportation costs into rehab centers, skilled nursing and hospice settings, as well as any terminally ill transportation as well. That's something that no other company will touch. So we want to make sure that our members are covered, our lifetime members are covered from the time they sign up until they no longer need our services. And then of course that also covers any kind of worldwide coverage for our dependents as well. So we are absolutely we love being able to tell folks what it is that we do, because it is a vital necessity. We're all going to go through this, and we need to know that we are protected, and we're protected like family. And that's what we do here at Global Medevac, is we want you to know that you are an extension of our family as our member, and you give us a call, we're going to take care of you 100%. There are a few items and folks that we do not cover, so we'll quickly go over that. Right off the bat, we do not cover anything regarding elective procedures such as cosmetic surgery. We also do not cover active duty military. Uncle Sam has a pretty good package for them. We do not cover the flight crew of a commercial airline while they're on duty. All the passengers, of course, and we would take care of that crew outside of their duty. But once they're working, they've got a pretty good package. We do not cover any events relating to mental illness except for dementia and Alzheimer's until they come up with treatments for those, and then we will. And then lastly, we do not cover any complications due to alcohol or drug abuse. So other than that, your Global Medevac membership covers you for all emergencies on day one, like I mentioned. And that is very vital, because there are programs out there that only kick in with stipulations. There are some of those plans that you have to be a certain mileage away from your home in order to use. There are some of those plans that do not include, as most of them, do not include full service. So they might include just helicopter. They might include just ambulance. We are full encompassing. Any kind of medical travel, we've got you there. With us, there are no claim forms to sign. There are no waivers to fill out. In fact, we won't even ask you one health-related question. For every American is pre-approved for that emergency 911 call. No matter where you are, home or away from home, no other company can truthfully claim that they cover what we do. No other company covers you like family, because to us, you are family. This is where I get this question. This must cost a fortune. How much is this service? Well, we have a plan for every person, every family, and every budget. Which membership is good for you? Let's talk about our 4 options once again. So on our monthly plan, it is the yearly option broken up into monthly payments. It starts at $38 a month. The yearly plan rolls up to $450 per month. Or I'm sorry, $450 per year. The 5-year plan does give you a benefit. It does break off a little bit of money from the yearly cost. And then lastly, we've got that lifetime plan for the individual, $2,850, for the family, $3,850, and you'll never have to pay for any ambulance service again. So we are almost done with today's presentation, just a few more minutes. I appreciate you sticking with me. So where does this leave us? Although it could be the flight that saves your life, the astronomical costs that follow, and the aggressive collection tactics from these ambulance providers have left many Americans angry, frustrated, and for some, bankrupt. A global Medevac plan provides you the only peace of mind against these catastrophic costs. NBC News tells the story about how dangerous it is not having protection really can be. So I've got one more video to lay it home for you, and then I'll be right back and we'll talk about this one last more, and then we'll answer some questions.
Counts. Helicopter ambulances provide life-saving services, but some patients say the cost leaves deep financial wounds.
I see doctors weekly, bi-weekly, monthly.
4 years ago, a head-on collision mangled her SUV and Jody Lopresto. Paramedics called an air ambulance to fly her 49 miles to this Oklahoma City hospital.
If a regular ambulance had got me there, I wouldn't have probably made it at all.
Grateful to survive, but shocked at the price. The bill, more than $38,000. Jody's insurance paid only about $6,000 because the ambulance was out of network, sticking Jody with a balance bill of more than $32,000.
Did you have $32,000?
I had nothing. I didn't even have $100 sitting anywhere. I wasn't working. I was looking at never walking again in my whole life.
She refused to pay.
Air Methods.
Instead, joining a class action lawsuit against the transport company Air Methods, which operates about a third of air ambulances nationwide.
The air ambulance is picked by someone else, called by someone else. There's no negotiation or even a disclosure of their prices in advance, and they send you a bill for whatever they want.
The company has argued federal law protects its pricing decisions and that it's pursuing insurance companies more than patients to pay the bill. Air Methods declined our request for an interview. So what does this service really cost? The industry association says the median cost to the company for an air ambulance is $10,200, but the price patients are charged is much higher. A recent government report says those prices doubled to $30,000 in just 4 years, and Air Methods prices rose 283% over 10 years. The industry says they lose money on many flights.
If insurance won't pay for an emergency medical transport deemed medically necessary by a medical professional at the scene, then what else is insurance for?
Some people are going to hear this and think, you're just passing the buck. You're just shifting the blame from the industry to the insurance company.
When 7 out of 10 medical transports that were deemed medically necessary by a professional at the scene of an accident or illness are vastly under-reimbursed, the obvious solution to this problem is to fix that under-reimbursement.
Meanwhile, patients like Jody are caught in the middle.
What would paying $32,000 do to you financially?
It would have destroyed me. That's a house, that's a car. Could be my son's college tuition.
As you can see, there are multiple examples of this that you can just research and find on a simple web search. If you go to YouTube, you can easily find videos, just horror stories about very similar experiences about how folks thought that they were covered and were not. So that's why it's important that you have this coverage, and that's why I'm here. So it really just comes down to one choice. Which plan are you going to choose today to protect you and your family, and which plan are you going to choose today to protect all of your the life savings that the nest egg and the life savings that you've spent building up? Because this is not something that, like I mentioned, that is not unique. 553,000 air flights were taken last year. Actually, in 2019, 2020's data hasn't come out yet. So it really is a vital service that we provide, and something that you need to think about, especially for your portfolio. This is something to protect your finances, not just your health. And you deserve that. You deserve to protect you and your assets. All right, folks. Well, that's it. Thank you very much for listening to what it is that we've got going on. On the questions down here, it looks like we've already passed the 30-minute limit. So I apologize for holding you up a little bit, but I will go ahead and get all of those questions answered via email. So thank you very much, everyone, for taking your time to be with me today. If you have anything that you want to get answered right away, give me a call. My number is 480-331-5772, and that's posted down at the bottom as well. Happy to get any questions answered that you've got. More happy to get you signed up and get you protected. So give me a buzz. If you fill out the form over here on the side, we can get all of that information taken from you today and get you signed up, so that way you're not worried about it even one more minute past this video. So anyway, I'd love to talk with you more. So give me a buzz, shoot me an email, and thank you very much for your time. All right, everybody. Thank you. Have a great day.